Hi, everyone. Thank you for joining this webinar put on by the Selective Mutism Association. I'm Dr. Rachel Busman, clinical psychologist from the Childmind Institute.
My name is Dr. Jami Furr, and I'm with Florida International University Center for Children and Families. I'm a clinical assistant professor.
So we're talking to you today about managing anxiety in the face of the coronavirus. We appreciate you sending in all of your questions, and we have worked as hard as we can to incorporate those questions and the answers into our content. So I'm sure everybody has a lot of information about coronavirus, but just a few key points here. Coronavirus, or COVID-19, is a respiratory illness that can spread from person to person. It is highly contagious and most often transmitted through close contact, and also when someone coughs or sneezes, and additionally from touching contaminated surfaces. So one of the things that the CDC has been telling everyone, and I'm sure everyone has heard it, is that hand washing for at least 20 seconds with soap and cleaning is very key, and also cleaning surfaces with cleaners like Clorox wipes and Clorox-based products. One of the other things that's been really important is a term that's now very much in our vocabulary, which is called social distancing, which means that we need to keep a certain distance, at least 6 feet or more, and really limit our interaction in large groups of people and out in public. Those individuals that are most susceptible to having difficulty with the coronavirus, because it really often is manageable. However, for the elderly and those who have pre-existing medical conditions, those are individuals that are more at risk. And we've included a link here to the CDC, which has a fact sheet with more information about the coronavirus.
So it's very normal for everybody to kind of be in a state of confusion right now. Things are changing by the minute. Most of us have now, our kids are out of school for at least 2 weeks. Some of you may have kids where they're pretty excited now. They think this is just a 2-week holiday. So some are thinking, you know, hooray, I'm off. And you're thinking, oh my goodness, this is, you know, how am I going to manage this? So, you know, we all know that kids kind of by nature are more egocentric. They're kind of focused on what they're thinking about. And it's really okay that they're excited to stay home. Some may not really understand yet what is kind of going on around them. And it's really okay also for you to feel more confused, to feel angry, to feel worried, and to be kind of still kind of in a state of shock as figuring out what is going on right now. So again, kind of be mindful in terms of what you're feeling, and also thinking about what kids are feeling too. So it's okay for the kids to express all kinds of different feelings related to COVID-19. So some may be expressing scared feelings or worried feelings. Some may really just be confused about what's going on, but kind of find out what they know already. So don't kind of interpret that they know everything already about it. Discuss what's really helpful about washing their hands, about kind of continuing to use good hygiene. Hopefully they've been doing it already, and that kind of helping them understand that most people getting the virus are doing fine and recover well, and really that we're kind of watching out for those elderly people who have pre-existing problems. And so we're really using that social distancing to make sure that we're keeping everybody as safe as possible. And if they are sharing their feelings, praise them for coming to you and opening up, and really try to keep those communication lines open so that they know that if they start to feel worried, that they can come to you at any time to discuss those feelings, and really praise them if they actually share those feelings with you.
And Jami, I think it's really important that kids might have questions and they might have no questions, and really both of those things are really okay. So one of the things that's really important to talk about is finding your village. So one of the best predictors for getting through a stressful time well is social support. And this day and age, with us social distancing and using technology, we really can extend the idea of social support through the internet and through like Jami and I are connecting here, and we're in different states. And so that's very important. So really finding out who your village is key. And your village could include your family. It can include your neighbors. It can include your extended family down the street, or it can include your extended family in different geographic locations. Your village is probably your school, and your school is communicating different things. Your village might include a mommy group or another caregiver group. It's really important to think about your village as the adults and kids and family members and larger community who can be part of a support network. It's also, again, important that extended family, you may have grandparents or other older relatives that you're not seeing right now because they live far away. Or it could be, in my case, I have my son's grandparents live down the street. However, we can still connect with them via webcam, and there are lots of ways to do that in inexpensive or free platforms. Another really important thing is to make sure that your kids and your teens are able to connect via video conferencing. And we're going to talk later about SM exposure specifically, but we're not necessarily talking about this in terms of a speaking exposure, but really just more connecting in other ways besides the phone. Children can definitely write notes to helpers or providers or heroes or caregivers and send messages, as can you as adults. And it's really important to help your children and your teens feel a sense of mastery by helping them know what they can contribute or what they can do. I think we lost Jami for a second, so I'm going to just keep going for a minute in terms of following your school's lead. It's going to be really important. So maybe I'll just wait for Jami. She's back.
Hello, sorry about that.
I thought we were doing on a roll. Should we just keep going or should we stop?
Yeah, we can keep going.
All right. So we're up to following the school's lead.
Great. All right. So many of you may be experiencing some of these things. What just happened to me? Everyone at home is now having to learn and function online, and some may get cut off in the middle of things that they're. I apologize for that. So it's really important to kind of stay kind of aware of what is going on with your child's school. I'm sure many of you, I think for the most part, a lot of schools are kind of shutting down at this point to try to encourage the social distancing. And so your school is probably communicating to you about any additional online learning services that you can go to. They may have their teachers already going to sort of a homeschooling format or an online learning format. And so you really want to kind of follow their lead in what they're offering and know kind of always go to them to ask questions. It seems, you know, from my own personal experience that there's always kind of a helpline or a call line that I can go to if I have questions what they're supposed to be doing. And I know some schools have already kind of made sure that the kids have their books at home, that they have they may have already coordinated laptops to go home, and or they weren't kind of prepared for all of this, and so they may still be sorting some of this information out. And you can always kind of think about, you know, balancing kind of what you want to with sort of waiting to determine what's going on. And I think if given everything is again changing by the minute, if you really aren't sure what you should be doing with your child at home regarding school, then you know, you should always go ahead and feel free to ask and get those answers. There are a lot of resources online, some of which we added to the end of the presentation for free educational resources, free art activities. There's so much coming out right now because everybody knows kids are home and that the majority of us still have to work and get things done for our jobs while their kids are at home. One key thing is that we know is really important is to try to keep your routine as possible. And this feels a little kind of, this may not feel kind of totally normal because you've got so many people home and you're trying to do everything else, but keeping a sense of stability and predictability in terms of a schedule and a routine for your kids really does actually help improve their emotional response to the situation. So research shows that we actually have better outcomes in terms of their emotional abilities and emotional kind of response, as well as our own emotional response to these stressors and these stressful times, if we can kind of keep structure and routine in place. So try as much as you can to kind of keep their sleeping schedule on time, their eating, their meal times and their bedtimes at kind of typical times. So I know when you feel like your kids are out of school, everything is a little more lax, and it doesn't mean you have to be getting up at the crack of dawn every day that you might, but trying to keep somewhat of a routine as much as you possibly can for everybody's kind of emotional well-being.
And I think that really goes without saying that it really for us too. So keeping a routine of sleep and waking up and even just showering and getting dressed into actual clothes is really, really, really important rather than staying in pajamas. So we've kind of broken up expectations and how to lay them out for younger kids and older kids. And again, your child might fit into the younger kid category or in the older kid, and there's lots of flexibility. So using a visual schedule can be really helpful. And again, there's a lot of latitude in terms of what that means. So for the past few days, for my son who's 9, I've been writing out a schedule that is just written out. And then yesterday I decided to go ahead and print one so I don't have to write it out every day. But there are lots of free printable schedules out. And I think tailoring them to your child's interests or what is creative can be helpful. We've also implemented a must-do list and a can-earn list. So we're still waiting for the school schedule, the learning schedule to come out. But I think in general, younger kids do well with predictability and knowing what is expected and what they can expect. So we have a must-do list with checkboxes and then a can-earn list. And I think this goes into sort of the screen time idea that everyone may need to be more flexible with their screen time, but it doesn't mean that rules go out the window. So it may be that you have 8 things that need to get done for the day, including outside time or reading or doing a math lesson. And at least I found really helpful having a list of like, when you get 3 of these things done, you will earn X. And X might be 15 minutes on the iPad. It might be playing a game together. It might be playing Legos, and then when you complete all the tasks, you earn this. And I think really just for older kids, the older the child, the more you want to include them in a conversation about what they think and incorporate their ideas, because often kids have really great ideas about what would be helpful and what they find rewarding. And then for older kids, really leading the conversation with inviting them to weigh in on their schedule can be really helpful. Again, with older kids and depending on the school, they may have a schedule of things that need to get done, but my guess is that it's not going to be as structured as when you're in school. So there's a lot of time for independent learning. And again, an older kid, and especially a teenager, is likely going to do better if you say, this is really uncharted territory for us. Let's figure out what's going to make sense for you in terms of your work, and then let's figure out what's going to be helpful to keep you motivated. Again, setting goals is really helpful. And for teenagers, we know that teenagers can sleep. It's natural. It's something that teenagers do. And we really want to balance good sleep hygiene, meals, exercise. And really, an additional thing is that considering how important peers are to all kids, but especially teenagers, it's natural that kids and teenagers especially are going to feel isolated from their peers, and keeping that going in terms of video chats or other activities that we can talk about in a little bit can really help them stay connected and decrease feeling isolated.
Exactly. So, of course, right now, everybody is probably feeling a bit anxious and worried. And so anxiety for you as a parent or caregiver right now is extremely normal. And so recognizing that and giving yourself a break for feeling somewhat worried about this situation is going to help you kind of move forward, and recognizing that we all still clearly need to kind of function and get things done in our daily lives, and also thinking about kind of making sure that our kids are doing okay with all of this as well. So self-care is really important here. So even though you're trying to manage your work life and your kids' school life and all of those things kind of at home now, you really want to think about what you can do for yourself, even if it's just taking a couple minutes away. Have a drink of water, have some, trying to have some family meal times together, having a break time. Maybe you have a special snack that you like, a special snack for your kids. And again, maybe just even trying to get some exercise, walks outside. You may be at the spa right now, but even if you can do some, mindfulness activities or meditation where you're really kind of getting yourself into a calmer place, is really going to be helpful, not only for yourself during these stressful times, but also for your kids, because you're modeling calm behavior and you're modeling good coping skills for your child, especially right now. As we talked before, really try to stay connected to your village. Again, use support to help you through these times. Connect with them, find out what they're doing to help each other, and really kind of keep that line of communication open with them, because that's your line, that's your village. As I mentioned before, try to be as confident as you can be right now. And I know that may be a little tricky given the situation, but children will feel more secure when they are around their parents, when they are showing calm behavior during stressful times. So it doesn't mean that at night, if you're feeling really worried, that you can go into your bedroom and talk to your partner about how stressed you feel, but in front of your child, try to stay as calm as you can. It doesn't mean that you can't express your concerns, but try not to kind of go into an extended emotional response in front of your child. It really is just trying to keep that more in a confident, calm manner, which again is really showing them good coping skills amongst these stressful times. Again, trying to enjoy time with the family as much as you can outside of what you have to get done for your work and the school schedule. But doing family activities together, one great recommendation that I saw was come up with a project that you guys can complete now as a family that you've got time to do over the next couple weeks. Again, I think this time really affords us some opportunity that we may not have thought about ever doing in the past. And remember, one key thing is that we are all in this together. So really kind of lean on one another for this.
Definitely. And I would just add also that, families are made up of all constellations of people. It could be one parent, it could be two parents, it could be a babysitter or not. And I think this is how the larger village can be helpful. So if you're parenting on your own, or you have limited time because you're working specific hours, really leaning on your village. And that might mean a school psychologist at school who is connecting to you remotely.
Definitely. And there's different systems put into place. I know, for example, our school district is trying to still deliver the meals to those kids and families who may not have additional resources to be able to provide the meals at home. Some actually still providing childcare for the first responders and the medical personnel who are having to go into the hospitals and provide care for other people who are sick. So I think there are resources out there, and it does seem like a lot of people are offering up support to one another. So even just checking on your elderly neighbors and checking on your neighbors, even if they're not elderly, and saying, hey, I'm here. If you need something, I can drop it at your door. You don't even have to see me, so that they know that they're surrounded by those who support them.
That's such a great point. So one of the things for this particular webinar, oh, sorry, Jami, I hijacked your slide.
No, no worries. So one thing that we want to keep in mind, because it's, again, we're in a kind of a day and age now where you have 24/7 exposure to the media, and probably, as most parents are doing, and grandparents and caregivers, you may be watching news quite a bit to determine what is happening, especially with this situation, because it is happening and things are moving by the second. What we do know, however, is that when you or your child are having constant exposure to the news and to social media related to the news and the situation, it actually can be very detrimental to your emotional health. So you really want to try to avoid the overexposure to the news and social media, and you really want to try to find credible sources for your information. Sometimes you can kind of go down a rabbit in social media that leads you to information that actually is not credible. And you want to try to only sign on or turn on the news a couple times a day. And if you know that these things are going to be a little bit more emotionally kind of filled, or you know that these things are going to be hard for your child to watch, don't watch those or don't look at the news while you're around your child. Maybe take a step away, look at it while they're reading a book, so that again you can kind of control your own emotional response to what you're reading in front of your children, and then kind of come back into the room where they might be. This really may be something you have to talk about with grandparents if you're all kind of living in the same place, and think about how you can manage this in front of your children, and also correct any misinformation that the child may have related to this particular situation, so that it's not only happening to one particular group, that anybody really in the world can get this particular disease at this point in time. So you're really trying to not foster kind of misinformation, and really again thinking about what that negative impact may be, and so really trying to watching the news in a smart way and educating your child on sometimes there's a lot of drama that can be built into the news, and really trying to disentangle the drama from like, okay, what facts do I really need to take from this? Can I relay that safe and kind of developmentally appropriate way to my child?
And then in terms of continuing SM exposures, which a lot of people have asked us about, and so we'll try to keep that conversation going. So first of all, we do know, just sort of by definition, kids are most comfortable speaking in the environment where they feel more comfortable. So at home, they're likely speaking to you, and so that's not necessarily where you need the practice, and at the same time, there are lots of things that you still can be doing. So one option is to contact parents from your class and see if they can do FaceTime or other video conferencing practice, similar to what you would do in person if you were doing a play date. Now that can have a lot of different sort of permutations, right? So one might be that your child's already started speaking to another person, and this medium, while a little strange, with your help, you can bridge that gap. For other children, they might not be anywhere near ready to talking to other kids yet, and that's still okay. You could still bring up a screen and just play with your child and facilitate talking just to you in the presence of other people. Again, new territory, but definitely still a step in the right direction. For presentation, some families have asked how that's going to work if using some kind of Google Classroom format or any kind of live learning. And again, that can be in a similar way, right? So it could be that it involves having the parent there and scaffolding the speaking for the child. It might involve speaking to the school psychologist or the teacher ahead of time and just giving some guidelines in terms of, please recognize that my child's there, but we're not quite ready for you to call on them yet. Yet is a really big word because it implies that it's in process. So I think there's lots of ways to do that via video learning. Another couple of things that came up that we don't necessarily have slides for are, right now schools are really prioritizing figuring out how to get access to learning for everyone. So I know in my school, parent-teacher conferences were supposed to happen last week and they were put on hold. So not my favorite thing that it was put on hold, but of course have to manage the distress of that with the priority. Similarly, maybe you've had plans to do some kind of training with your teachers or your team, and I think that can still happen. Many clinicians, if you have a treatment team, they can work with you to figure out how to train teachers even in the absence of being able to be together. It might not happen this week, but it's still certainly something that can happen. One more thing before we go on to the next slide is that one question was about balancing safety and exposure. And so one thing that I recall, one of the questions was about, like, maybe something hasn't been canceled in your community and your child has been practicing for it, like a play or a concert or some kind of activity, but you as a parent are feeling uncomfortable with having your child join. I think that's, to me, very reasonable to, one, make your choice as a parent and do what's best for your family, and then be able to explain to your child, hey, Jami, like, you've worked so hard on this dance and you've been working amazing, super brave, and it's really disappointing that we won't be able to do it, and I'm still so proud of you. So I think having that statement it acknowledges, and your child may be super upset, or they may not care at all, or in every range in between, but really just saying, you know, we're opting out because that's a family decision, and you're still really proud of your child.
And maybe there's a way to use some of the video conference platforms to still allow them that opportunity to perform the thing that they've been practicing. So maybe they can still sing their music or perform their concert music if it's an instrument by video, or you can get extended family members together, something in which they still have that opportunity to feel like they did it, and feel proud of themselves for doing it, even if it's not in the full capacity that they were going to be able to do before. And I think, you know, Rachel is right on. And as a parent, you kind of also have to trust your gut in feeling, you know, is this a safe situation right now or not? And sometimes there are still situations in which you're able to go out. You know, at times there's still like very short trips to the grocery store. And again, not that you're having full conversations with anybody at the grocery store, but it may be that there's still an opportunity to just even ask a question from your 6 feet separation, or telling the person through the door to leave the package at the doorstep, things in which they're still able to get some, even though it may not be, again, to the extent that we would want it to be happening right at this time. So we only do, oops, about that. We only have a few kind of, there are some mental health resources, again, kind of taking care of your own mental health during this time. A lot of what is discussed in this particular article, and what I could find in a lot of these other articles, are things that we already sort of mentioned. So really kind of taking care of yourself, practicing some mindfulness and meditation. There's some great mindfulness exercise that you can do with your kids, again, during this time, which can be really helpful. And then we did list just a few kind of links, activities. Scholastic has full free resources for the full, for lots of different ages, actually, and then different art sort of activities that people can do. Rachel?
So thank you so much for joining in. Thank you for sending your questions ahead of time. And we really just, this is a village to us as well. And so we hope that we can just continue to stay connected and keep the conversations going. Thank you.
Thanks for your attention.